We've all seen the symbol for an electrocardiogram, or ECG. Sometimes this symbol appears on the signage for some health centers and even on jewelry. We recognize it on the monitor on TV shows when a lead character is in the hospital. It is used for dramatic effect when the actor flatlines. The electrocardiogram is also referred to as an EKG. Why? There's no K in it. Well, sometimes ECG sounds like EEG, the abbreviation for electroencephalogram, which measures electrical activity in the brain. We need to make sure we're talking about the right body part, so sometimes EKG is used instead, which is the German spelling. But what does that squiggly line tell you exactly? Does it only tell you if you're alive or dead? Well, it's a little more complicated than that. So I decided to get to the heart of the matter, so you don't have to. The heart beats because of special cells that produce electrical impulses. The EKG is a tracing of electrical activity in the heart. If your heart is acting normally, the electrical impulse takes the path as shown in this illustration of the heart. This electrical impulse travels from the sinoatrial node, or SA node, the heart's natural pacemaker, then travels across the atrium to the atrioventricular node, or AV node, through the ventricular septum of the heart. This is what causes the four chambers of the heart to contract. The EKG illustration allows us to understand this. An EKG can be divided into three basic parts for the purpose of this explanation. The little hump, labeled P, called the P wave, designates when the electrical impulse is spreading over the atria and signals the beginning of their contraction. The steep peak that is labeled QRS, known as the QRS complex, designates the spread of electrical activity through the ventricles and the beginning of ventricular contraction. The little hump, labeled T, designates the recovery phase of the ventricles. This is normal sinus rhythm and indicates that the electrical impulse is being properly transmitted through the heart muscle. Now that we've looked at what a normal EKG looks like, let's take a look at some EKGs that are abnormal, that look a little different. Here's one that shows ventricular fibrillation. This is an abnormal rhythm where the ventricles of the heart quiver. This is shown on the EKG by irregular QRS complexes without any clear P waves. This can occur due to coronary heart disease, electric shock, or cardiomyopathy. VFib is one cause of cardiac arrest. Since the ventricles are not contracting in a coordinated fashion, the ventricles fail to pump blood adequately through the body. Another abnormal EKG is atrioventricular block. This occurs when current through the heart gets delayed or stopped. You can see this interruption on the EKG with the absent QRS complexes. Some of the causes of AV block are coronary artery disease, illnesses such as rheumatic fever, lupus, and Lyme disease, electrolyte imbalance such as too much potassium, medication for high blood pressure, specifically beta blockers. This EKG shows premature ventricular contraction. PVCs are extra heartbeats that begin in one of the ventricles. These extra beats disrupt the regular heart rhythm, causing a fluttering or skip beat sensation. PVCs start in the ventricles instead of the atria, and the contractions usually beat sooner than the next expected heartbeat. On the EKG, PVCs appear as premature and strangely shaped QRS complexes that appear wider than normal. Some of the causes may be medications, alcohol, caffeine, anxiety, or injury to the heart muscles. Atrial fibrillation, also called AFib in all the commercials, is an irregular and very rapid heart rhythm, where the atria beat chaotically and irregularly. Left untreated, AFib can lead to blood clots in the heart. This increases the risk of stroke and heart failure. Some people with AFib have no symptoms, while others may have a fast, pounding heartbeat with shortness of breath. There is no identifiable cause, and AFib often runs in families. It can be treated with medication. Famous people with AFib are J.J. Watt, Billie Jean King, President Joe Biden, and Senator John Fetterman. The EKG for atrial fibrillation shows an absence of P waves and irregular QRS complexes. The EKG is a lot more nuanced than the gloss-over treatment I gave it here. This video just addressed the basics when it comes to reading an EKG. Some of the things that we complete amateurs may be able to see are the P waves. Are they there? If the P waves are there, are they followed by a QRS complex? Do the P waves look normal? As far as the QRS complex, how wide is the wave? How high are they? Is their shape normal? About the T waves, are they too tall? Are they inverted in the wrong place? Are there two peaks instead of one? Are they flat? Learning how to interpret the small differences on an EKG can take years to learn and is a specialized skill. It sure takes longer than the 3 or 4 days I spent on it. I hope you enjoyed this video and got something out of it. Don't forget to like, subscribe, and hit that notification bell to give this lifelong learner some love.